Thank you to our panelists, our speakers, all the people who contributed to this agenda, especially to our leadership, and in particular, our audience. You are making this possible, and our virtual audience have been so engaged into this discussion, and this is what we would like to move forward. I think I heard earlier that this is a strategy that inspires action, and this is exactly what we are trying to accomplish today. So, Anthony?
Again, I want to echo the thank yous. Certainly, thank you, Douglas, for bringing us all here today. Thank you for bringing everybody online, because we have a strategy. It's our strategy, and it's our time. So thank you for bringing us all here. And before I finish, I do want to call out some names: Gina, Gabriel, Shannon, Marvell, and Robert. You inspired me beyond my expectations today, so thank you for speaking your truth. So thank you very much. And with that, given how many people need to get out of here and catch flights, including myself, to help us close out, please welcome back Dr. Ron Valdiseria. I'm sure I pronounced his name wrong. Sorry if I pronounced your name wrong. Did I say it right?
Yeah, you were close. So let me say that I was wise enough to book a flight tomorrow morning, but for those of you who are leaving this afternoon, I will be quite brief. I was asked to give some closing remarks, and I'll begin by saying that nothing that I will say, I think, can in any way add to the already wonderful comments and observations that you've heard throughout the day. So instead, what I thought I would do, I think some of the clinicians know that mindfulness training now is very popular, and it's an important kind of therapy. But I thought what I would do is try to be mindful about what I heard today and share just some feedback about what I think about the updated strategy. So I'd like you all to be mindful of the following observations. First, I'd like to say, this is perhaps a bit downbeat, but I want to remind everyone that our triumph over HIV/AIDS in the United States is not a given. I will remind you that you've heard from multiple speakers about increasing incidence among young black MSM. It hasn't really been mentioned much, but all of you are aware of the fact that a tremendous outbreak of HIV and hepatitis C virus took place in Indiana this year at a time when we thought in the US basically we had the epidemic, the HIV epidemic among injection drug users almost licked. I will also remind you that we have a cure for hepatitis C virus, but yet more people die from hepatitis C every year than from HIV. And we have a vaccine for hepatitis B, but we still have close to 1,000 babies born every year with perinatally transmitted hepatitis B. And I say that not to be pessimistic, but to remind all of us, again, the theme of mindfulness, that we absolutely must be vigilant and persevere. We're making progress, but if we let our guard down, bad things can happen. The second comment I'd like to share, and again, this was reflected by many speakers today in many different ways, and I'm just going to encapsulate it by using language from the World Health Organization General Assembly, that health is more than the absence of disease. And I think we've heard many people reflect back that we need to treat the person, not the virus. Several speakers also reminded us that people are more important than viral loads. Now, again, I'm not minimizing the importance importance of having a suppressed viral load. I think any of the clinicians in the audience and any people living with HIV understand that importance. But I think that the point that you heard throughout the day, and it is reflected in the updated strategy, is that we really have to address people holistically and take a holistic view of health. And this leads me to the next observation, which is very much related to what I just said, and that is that we must care for the person, but we need to think about systems. I personally think one of the reasons that the Ryan White program has been so successful is that from day one, it took a holistic approach to HIV and didn't just focus on the medical aspects of the disease, but also looked at other issues like housing, food support, transportation, legal aid, et cetera. And again, any of you working in the field of public health, whether you work in HIV/AIDS or not, understand now the increasing importance of looking at social factors that impact health, the so-called social determinants of health. And that's why you will find in the updated strategy, and you heard many speakers today talk about the importance of looking at issues like employment, looking at issues like education, food security, safety, especially safety for vulnerable women and young girls. So I'm not trying to pretend that it's easy to address all of these social determinants of health, but I will say that if we want to successfully implement the strategy, we have to not only attend to the needs of the person, but also we need to think systems. And how can we link our systems? How can we get them to work better together? An issue that just came up in the context of PrEP relates to my next observation, and that is that knowledge that is not fully used is wasted knowledge. And we heard a number of observations made about the distinction between what we know from clinical trials in terms of the ability of PrEP to prevent HIV transmission, but what do we know really about how it's implemented in the real world? And that extends to many different kinds of research, not just biomedical research. And I would propose to you a metaphor that if any of us, and I don't think any of us in the room believe this, but we have to continue to remind investigators that the goal of clinical investigation or basic science is not just getting something published in a journal. And I think that, we like publications in the journal, don't get me wrong, but the more important issue is to use that information. Having something that's published in a journal but it's not used is like writing a beautiful piece of music that no one hears. So how it might be a beautiful piece of music, but no one's hearing it. PrEP's just one example of that, but I think the focus on implementation issues, when you take the time to read the updated strategy, and I hope that all of you will, it's very well written. Amy and Douglas and Kat and all the others did a great job. You'll see these themes of implementation. The next observation I want to make is, again, not unique to me. You've heard it expressed much better by many other panelists today, that it's absolutely imperative that we confront stigma wherever and whenever we find it. Now, let me say that sometimes it might require a gentle hand to confront it, and sometimes it might require righteous indignation. Because let's face it, some of the forms, now I know this is different for different people, and it's probably greatly related to one's circumstance in life, but some of the forms of stigma that we're talking about now are fairly subtle. They're not always quite as blatant as they were. Some of the old timers can remember back in the mid '80s. We heard the example of the child having to sleep in the bathtub, so some of that blatant stigma is still taking place. But I would posit that a lot of us are encountering different forms of stigma, whether that relates to an individual's class, an individual's sexual identity. It even has to do with issues related to other health conditions. I mean, all the stigma, the tremendous stigma we have in this nation around mental health issues. So I would say that it's really important. Again, there are different approaches. Sometimes it can be done with a gentle hand, sometimes maybe not so gentle, but it's very, very important that any time we encounter something that lessens the dignity of an individual, that we call it out. I also want to share an observation that I think has been quite evident from the many different presentations that you heard throughout the day, and that is that we have to, I think Dr. Satcher referred to this when he talked about the philosophy of not only teaching students but learning from students, that it's really important that we learn from one another and that we help one another. And there are a number of reasons why that's true. I mean, I think first of all, it's probably a very important cultural value. It's probably what's helped us survive so far as a species, and I hope we're going to keep doing it. But it's also important given that we all know that it's not like there are hundreds of millions of new dollars coming down the pipeline. And so I think we have to continue to advocate for unmet need by all means, but we have to work together. One of the last panelists, Dr. Kolber, mentioned this about how even in an academic institution, and you know, if there was any place more siloed, or maybe the federal government's siloed, but you know, academia historically has tended to be fairly siloed. But Dr. Kolber gave the example of how they reached out and worked with different parts of the community. And it goes in both directions. I think that we can learn from community, community can learn from professionals. It makes us stronger. It gives us a more powerful alliance, and it also reflects the fact that there's no single action that we can undertake that is going to either improve HIV care or keep people safe from infection. The reality is that there are many actions that have to be put into place because of the complexity of how we define health. So let's continue to learn from one another, continue to help one another. It's okay to disagree with one another, and often we do, but I think that if we have the same goal in mind, which is to improve health outcomes for people who are living with HIV and for individuals who are uninfected but at high risk for infection. We want to prevent them from becoming infected. We share that goal, so I say kind of let's work backwards from there and figure out where we can come together. So let me end by, this actually is a quotation of my own making. Some of you know that I love the shared wisdom of looking at wonderful quotations from people throughout history. I didn't have the foresight to do that beforehand, so I wrote this myself, and I would like it to be my closing words to you this afternoon, that no great work is accomplished by a single person, or through a single organization, or during a single period of time. And it's certainly not accomplished without effort, focus, and perseverance. So let's leave today by keeping the vision of the updated National HIV/AIDS Strategy first and foremost, move forward, continue to do great work, and we will grow stronger and help people live healthier lives. Thank you so much.